people will join. Just try sending some message in the YouTube with the second instrument.
Good evening, Father.
Good evening, good evening. No smiles? Yes.
Thank you so much, Father.
There were some options I would have written OET for all of you, but I enjoyed writing. No option available, right? Yes, Junior Madhushree, hi. What's your daughter's name? Yes.
Yes.
Shiran. Yes. Hello. Good morning, good afternoon, good evening. Where are you from?
Good evening, Father.
Very good evening.
Good evening, Father.
Good evening. Is it in focus mode at YouTube?
Yes,
Hi. What's your name? What's your name?
Swadip.
Swati.
Parit.
Farid.
Yeah, Parit.
Farid. Oh, sweet name.
Thank you.
Yes. Is she going to school?
Yeah, she is going nursery now.
No, sir. Yes. It's a prime time to train them.
Yes, Father. That is the
Starting from 4 or 3. 3
Yes.
to 6 is the prime time. 90% of the development things, skills will be
Yes.
acquired before we are 6 or 7. Yes, we are waiting 2 minutes for the people to join us. Yes. Sultana. Chandravadini is not smiling. Okay. Right. Mhm. Yes, type in where are you from if there are some newcomers at YouTube comment space. Yes. Farid will sing a nursery song now.
Good evening, Father.
Good evening.
I'm saying
What's your mother tongue, Madhushree?
Kannada, sir.
Kannada, okay. Where are you from?
From Mysore. Now, presently, I'm at Bangalore, residing in Bangalore.
Proper Mysore?
Yes, sir.
It's a Kannada. Yes. Right. Hello, hello. Right. People are delaying. No time. Don't make this in the subgroups, only those who complete the mock test and their mail. Question from. Yes. And for the active learners, Zoom link is in your groups. People are asking for Zoom link, Zoom link. Those of you who have completed your mock test and sent your self-assessment form, if you are at YouTube, you can let me know. We will admit you here. Okay, we'll begin. Let's have a minute silent, right? So once again, good evening and welcome to Edu Skills OET Made Easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing to the channel, give us a thumbs up. If you like our mission, and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling to crack OET. And this is an absolutely free platform. And you can get all the details and links in the description of every video. There are more than 1,000 sessions uploaded on all the subtests. This is a platform of the health professionals by the health professionals and for the health professionals. Keep smiling. Today we'll be dealing with reading part C, explanation for the mock test, and that is cardiovascular disease, CVD. Let me share my screen and keep interacting in the YouTube comment space so that we reach out to maximum number of people. Thank you for the super chats. You can get a super chat for ₹10 or more. Okay, thank you, thank you. Yes. So let me know if you can see the screen.
Yes.
Father, it's
At YouTube. Check. Yes. Yeah. So reading part C, Occupational English Test, cardiovascular disease. This was the text number 1 of our mock text, reading key skills, cardiovascular benefits of exercise. This we shouldn't be skipping, right? This is the most important part. Next one, cardiovascular benefits of exercise. Is the tone negative or positive?
Positive.
Positive. Benefits of exercise. So ultimately, options the speak and support benefits of exercise. Supporting exercise options will be the right options. So we should be able to foresee that. Okay, because the writer is propagating exercise, regular exercise, guided exercise, and he will explain various benefits of exercise and how does it reduce cardiovascular conditions. So storyline. Okay, I used to explain this in the initial stages. Later on, I found our students are just concerned about the right answers and not bothered about the details. So I stopped. But then some people were interested, so we have started again about the storyline. Storyline means you should be able to foresee the first method of reading. First step is foreseeing. Second step, investigation, mean to say ask questions. FIRST. Foreseeing means predicting, speculating, just guessing what you know about it. Then second one is investigation. Investigation means ask why. Why exercise? When? Where? How? Who has to do it? For whom it will be beneficial? All the WHN questions and how you ask those questions and try to answer even without reading the text. So you have an idea. Third one is reading, real reading. Okay. Then S stands for speaking out, means summarize and speak out, which will help you to understand 70%. Then writing means teleprinting. That is writing. T stands for teleprinting, means writing. So just let's see. One sec. I'm stuck. I have to go back. Yes. Now, cardiovascular benefits of exercise. What things could be included here? Could you just shout out or comment in the YouTube comment space? Yeah. What will be there? Cardiovascular benefits of exercise is the title. If you ask questions, who has to do the exercise?
Patient.
Patients. Is
with
it
cardiovascular disease.
is it patients means is there some differentiation between elderly people, young people, and teenagers and kids? Is exercise good for everyone?
Yes.
Yeah, adult.
It's about adults.
Yeah. So write down all, or it applies to everyone. Okay. Write down these things. Then When they should do it,
In the morning.
how they should do it,
Regularly.
regularly and guided.
Guidance.
Guided. Okay. Such questions you can ask and answer. Whether it is right or wrong, that helps you to understand when you come to such points. Okay. Even if you had a wrong answer, your mind will be analytical when you read the thing. So, storyline. What is a storyline? Paragraph 1 states a problem. There is one instrument in the Zoom not muted. You will be removed. Okay. Please mute if you have a background distraction. So please don't enter Zoom if you are not a serious learner who can invest full time. Enter Zoom, okay? Yeah. See, yeah, when yesterday there was a problem, right? Okay.
Yes,
Today
Father.
also there is a problem. Okay. Then para 2, the cause. Then there is a problem. Immediately your mind goes, what is the reason for the problem? Who is the reason? What is the reason? Please. Yeah. If you have somebody, kids around, please don't interact. Okay, others will interact. Yes, para 3, the proof, the evidence. Para 4 speaks about the benefits. Benefits of what?
Exercise.
Exercise, definitely. Because exercise is the main topic. I'll have to remove that person because disturbing continuously. See, if you don't respect the platform, we will be permanently banning you from the platform, okay? Because you are disturbing everyone. Sorry to say that. See, we are allowing you to enter, but mute if you have distractions. Try if you are a serious learner, try to sit in a place where there is no distraction so that you can interact. Para 5, the treatment. Okay, now there is a problem. What is the treatment? How effective it will be? All those things. Para 6, the prevention. Normal for anything, any condition, you have these things, right? You think of treatment, you think of prevention. Okay. Then exercise comes under management. Para 7, the solution. Okay. The problem is CVD is increasing worldwide. Cardiovascular disease is increasing worldwide is the problem. Now, what is the cause? Inactivity is a major contributor. No activity, continuously sitting in the office and working. Inactivity is a major contributor, which means there are other contributors as well. The proof, active workers have healthier hearts. Active workers have healthier hearts. In the question here, when you speak of proof in the structure, paragraph structure, where will be the answer? In which sentence?
Support.
Developing sentence. Proof means evidence, right?
Sorry.
It's not explanation, it's evidence. They'll be speaking, giving some active workers, example of some active workers, and saying, proving, see, these people who are really active, they have less CVD than the inactive people. A proof is given. Then exercise benefits even high risk patients. Means it benefits everyone. Then supervised exercise improves outcomes. Supervised exercise improved outcomes. That is the treatment of para 5. And para 6, start exercising early and continue for life. When should you exercise? The answer is as early as possible till the end of your life. Okay. So 7th, the solution, physician should actively promote exercise. Physician should actively promote exercise. Okay, now if you have space there, you can write the question stems there. Okay, question, main idea in the question just in front of it. So that will help you. If you have space for one more column, don't write on the table. Okay, yes. Okay, this is the flow. Now coming to exercise question 7. Point about CVD. The first paragraph was speaking about the problem. What was the problem? CVD. What is the point about CVD? What point does the writer make about CVD? Cardiovascular disease. What is his point of view? What does he say in the first paragraph? And question 8 speaks about inactivity. About inactivity. Already we have seen, right? In the previous column, what is written there in the second paragraph?
Inactive.
Yeah, what was it? Read the full thing. Read the full thing.
Inactivity is a
Inactivity is a
major
major contributor.
contributor.
Yeah. So inactivity versus exercise. I have just put it. You have to connect. When you say inactivity, you have to say the title is exercise. Okay. And question number 9 mentions London bus drivers, which is an example. Okay. The paragraph mentions about an example is given, proof is given. You see London bus drivers continuously sitting, and you find a lot of CVD sufferers over there. So example in the developing sentence. 9, 10, lexical question. And 11, suggestion about taking up regular exercise. Suggestion of whom? Writer's suggestion about taking up regular exercise. Question number 12, short and long-term CVD benefits derived from dash. Imagine what could be the gap filler here. Connect to the heading.
Exercise.
Derived from exercise.
Exercise. Long-term and short-term benefits of exercise. Yeah. And the 13th one, reason for supporting guidelines for US high school students. Reason for supporting guidelines for US high school students. Some exercise guidelines are given. Why is the writer supporting that guideline? Because it supports exercise, right? Because he is in favor of regular exercise. 14th, suggestion about physician promoting exercise. What does he suggest to the physicians to promote exercise? Write in 3 columns if you have. I could not make it 3 columns here. It will not be visible. Okay. So what was the first column? First column, the main idea. Main idea. Second column. First column was the main idea of the paragraph. Second column was
Supporting
what was
questions.
Comparison.
Reason and cause.
Now, what was the heading given? In the first column, what heading was given?
CVD is increasing worldwide.
No, that is, you are speaking about the first paragraph. I'm asking now, exercise is given here, no? What was the heading in the first?
Paragraph sequence.
Other than that, sorry, I have to go back. You're not getting me. Okay. Storyline, right? Storyline was the heading.
Okay.
So this is about paragraph. What is given in the paragraph sequence? This is the main idea. You can write the sequence of paragraph, then the main idea in the paragraph. Next column, the question. Main idea in the question. So it's giving the sequence, then the main idea in the paragraph, main idea in the question. Did you understand?
Yes.
No? Should I make here? I'll show you an example probably. Some people didn't get it. Come on, one sec. Okay, let me try if I can make it smaller. See, there should be 3 columns. I am creating one more column here. Okay, this is the 3rd column. Okay, the first column, you can put the heading as sequence. Sequences, do you understand what is sequence?
Yes.
The order of the paragraphs.
It's a pattern, right?
Yeah, first column
Yep.
speaks about the sequence, the problem, cause, proof, benefits, treatment, prevention, solution. Then second column speaks about the
Main idea in the paragraph.
main idea in the paragraph. Main idea in the paragraph, in each paragraph, okay? Okay. Then
Main idea in their question.
yeah, exactly. Main idea in the question. Main idea in the question. Dilbar, did you get it?
Yes, Father.
Yeah. So I have made only 2 columns. You have to make 3 columns. You can understand, right? I need not make all the columns, right?
Yes, Father.
You should make columns for every paragraph, 3 columns each, like this.
Okay.
Okay. And what you have to fill in the 3rd column? First
Question.
column,
Main
what
idea in the
was
question.
that? Tell me so that I can type here.
Point about CVD. Point about the
Yeah,
CVD.
point about
CVD.
CVD.
CVD. Yeah, that is writer's point, author's point. What point does he make? So also you have to write all of the things what I gave you in this one exercise. In this one, you have to write here in the 3rd column. Okay. Somebody will present it in the and send a copy in the main platform so that others will understand. Okay. Got it?
Yes, Father.
Yeah. So this, if you are very sure about these things, you will understand the paragraphs very easily. Now, next thing what you can do is connect the right answer option. Make one more column, then you write down the idea in the right answer option. There is a right answer option, right? Which you select as per the key. And you will see the connectivity. The problem is CVD, and he is making a point about CVD. What is his point about CVD? Did you get it?
Yes.
Yes, Father.
So you will have 4 columns. One is paragraph sequence, so the logical sequence. Then my main idea in the paragraph, and
Main idea in the question.
main idea in the
Question.
answer option. Answer option, right answer option. In the answer option. Did you get it?
Yes, Father.
Yeah. Main idea in the answer option, which means you have to understand the answer option and write here in short. In the 4th column. Shall we go forward?
Yes,
Father.
Father.
Yes, main idea, sequencing. So, introduction problem, CVD is increasing. Function is this problem, factor, or the sequence is this factor. Factor means reason. Introduction paragraph speaks about a problem. CVD is increasing, but many risks are modifiable. The introductory paragraph says CVD is increasing worldwide, but many risks are modifiable. You can change the risks or the factors. Risk factor, inactivity is a major modifiable risk factor. I'm just giving you the gist, okay? 3rd one, supporting evidence, workplace exercise reduces cardiovascular risk. Workplace exercise reduces cardiovascular risk. Example of London bus drivers are given. 4th one, clinical evidence, exercise benefits high risk and elderly groups. Exercise benefits high risk CVD patients and elderly groups. Intervention, supervised exercise programs improve outcomes. Prevention, exercise should start early and continue for life. Implementation, physicians can promote exercise successfully. This is the main idea, what I gave you here, but I have given in more detail here, okay? See what I gave you in the 2nd column earlier? The same thing, little more elaborated. Little more elaborated. Why I am making all these columns and spending so much time? So that you imitate the same thing. That really enhances your understanding when you go to the paragraph. Okay. Now let's go to the first paragraph. In the first paragraph, what point does the writer make about CVD? We have already seen that, right?
Yeah.
About CVD. Writer's point about CVD. Option A, measures to treat CVD have failed to contain its spread.
Fail to contain its spread.
Okay, fail. Concept is failed. Okay. I'm not doing concept-based edging words, differentiating edging words, all those details because we are all experts and advanced students, which you have to do, okay? Sorry. Option B, there is potential for reducing overall incidence of CVD.
Reducing.
Reducing overall.
Yeah, potential for reducing or reducing.
For reducing.
Okay. And C, option C, effective CD treatment depends on patient cooperation.
Patient cooperation. Patient cooperation.
Genetic factors are
Treatment.
likely to play a greater role in controlling CVD. Genetic factors.
factor.
Give me 1 minute. Admins, can you find out who is disturbing the background disturbance? You are made co-host to assist me, okay? Otherwise, why should I make you co-host? Continuous disturbance without me getting disturbed or distracting other students, you should be able to handle it. Okay. Now, what do you think could be the idea of the writer? I said he is speaking or advocating or supporting the benefits, numerous benefits of exercise. Among these options, will you say CVD treatment failed is spread? Will you be speaking about the treatment? Exercise is treatment or lifestyle changes?
Lifestyle
Lifestyle
changes.
changes.
Yeah.
Lifestyle
So will you be speaking about in the introductory paragraph treating CVD?
No. No.
No.
No, because our heading itself is lifestyle change, right? Exercise.
Yes.
Benefits.
Benefits
Yes.
of exercise. I'm just trying to give you some technical gymnastics, okay? Okay. So you can eliminate it. We may not be right, okay? Let's see. And now, effective CD treatments depends on patient cooperation. Now again, this is treatment. Will you be presenting treatment in the introductory paragraph? Introductory paragraph has to give the focus of the whole article.
Yes.
Can he give treatment?
No.
Explain treatment? No.
No.
And genetic factors are likely to play a greater role in controlling CVD.
Genetic factors.
Yeah, maybe. I don't know. But then, which is more favorable to his opinion or his position? If there is no possibility of reducing CVD, should he write all these things and motivate people and tell the physicians, please guide the patients to do regular exercise? Your advice will help a lot in reducing. If he doesn't see potential, means there is a possibility, right? If there is no possibility, will he be advocating it? If there is no possibility that he will learn from me, will I be taking sessions?
No, Father.
No.
Since there is a potential, so as you become competent, you will understand the tone of the paragraph is this, or the article, the whole article is there is potential for reducing overall incidence of CVD. How? By changing lifestyle, by regular exercise. Do you get me?
Interesting.
Because introductory paragraph has to give momentum to the whole article. Okay, let's read. Somebody please. Fast, okay? We have to go faster.
Okay. Cardiovascular disease, CVD, is the leading cause of the death for both men and women in the United States. According to the American Healthcare Association, by the year 2030, the prevalence of the cardiovascular disease in the USA is expected to increase by 9.9%, and the prevalence of both heart failure and stroke is expected to increase by approximately 25% worldwide. It is projected that CVD will be responsible for over 25 million deaths per year by 2025. And yet, although several Risk factors are non-modifiable, such as age, male, gender, race, and family history. The majority of contributing factors are amenable to intervention. This include elevated blood pressure, high cholesterol, smoking, obesity, diet, and excessive stress. Aspirin taken is in low dose among high-risk group is also recommended for its cardiovascular benefits.
Okay. So any idea? There's a contrast word, right?
Yeah, and yet, although.
Yet.
Although.
So although is an expression in a complex sentence. Okay.
Yes.
Although several that says that is the dependent clause. Although where will be the message in the dependent clause or independent clause?
Independent clause.
Independent.
So the main message is after the contrast word in the independent clause. What is the independent clause?
The majority of contributing factors are amenable to intervention.
Yeah. What does it mean?
Amenable means you can change it, right, Father?
Yeah, you can change.
Modifiable.
Yeah, you can modify it.
Yeah.
That means that is a paraphrasing of there is potential for reducing overall incidence of CVD.
Yeah, P.
Till here, what they are speaking is CVD, worldwide, death, increase, all negatives. Till this point, till the contrast word. Yet, the majority of contributing factors, what you are speaking, are amenable to intervention. Means potentially you can reduce the incidence. Did you get the idea?
Yes, Father.
So,
It's majority and overall.
majority of the contributing factors means causes can be changed, can be altered so that the incidence of CVD will be reduced. That's the main argument of not this paragraph, of this article, because this is the introductory paragraph. The first answer will give you the position of the writer or the author. Do you get me?
Yes, Father.
Yeah?
Yes. Yes.
Yes. So, majority of contributing factors are amenable to intervention is potential for reducing. Potential for reducing, that is a synonymous expression. Synonymous expression. Is that clear?
Yes.
Shall we move on?
Yes, Father.
The answer lies after the word yet and in the complex sentence which follows. Yeah, Talafa, you're right. Yes. And in the complex sentence, majority of the times, 99%, there will be exceptions. Most of the time, it will be in the independent clause, not in the dependent clause. Okay. After the contrast word, a complex sentence is there means you have to focus on the independent clause. Independent clause, what follows is followed by a comma is a dependent clause. Now, what you see here before the comma, before this comma,
Although several risk factors
that
are
is dependent clause.
non-dependent clause.
What I highlighted in green is independent clause.
Independent clause.
Yes. I'm sorry. Okay. That was question 7. Question 8. In the second paragraph, what does the writer say about inactivity? See, writer say his opinion about inactivity. Okay. Option A, its role in the development of CVD varies greatly from person to person. Varies from person to person. Okay. Activity role. It varies from each person. Exercise. What is activity? Exercise. Its level of risk, its means the exercise level of risk lies mainly in the overall amount of time spent in active.
Overall amount of time.
CVD, yeah. Overall amount of
time spent.
Time spent in active. Then its true impact has only become known with advances in technology. It speaks about technology. Okay. Its long-term effects are exacerbated by certain medical conditions.
Certain medical conditions.
Okay. What does he say about inactivity? Okay. Which will be the positive possible thing? This speaks about person.
B.
B.
This speaks about technology.
Medical
This
condition.
speaks about certain different medical conditions. But are we concerned about how many medical conditions here?
No.
No. We are concerned about CVD. Okay, let's presume if it is B, we will not confirm it. Let's check. Just to give applying our mind into the question and answer options. Please read.
One modifiable behavior with major therapeutic implications for CVD is inactivity. Inactive or sedentary behavior has been associated with numerous health conditions, and a review of several studies has confirmed that prolonged total sedentary time has a particularly adverse relationship with the cardiovascular risk factors, disease, and mortality outcomes. The cardiovascular effects of leisure time physical activity are compelling and well documented. Adequate physical leisure times activities like walking, swimming, cycling, or stairs climbing done regularly have been shown to reduce type 2 diabetes, some cancers, fall, fractures, and depressions. Improvements in physical functions and weight management have also been shown, along with increases in cognitive functions, quality of life, and life expectancy. Thank you.
Okay. Yeah.
Sedentary mostly.
Any
Speak
idea?
about the sedentary.
Yeah, all
Speak about
takes
sedentary life.
Topic sentence.
Yeah.
all takes about risk of the sedentary, yeah?
Father, I focus the fact and I highlight the only fact part.
Which one?
The review and several study has confirmed that prolonged total sedentary time has particularly adverse relationship with cardiovascular risk factor, disease, and mortality outcome.
Okay.
I feel like this is a fact. That's why I have to focus the fact.
Yeah. Inactive or sedentary. Inactive means sedentary. Behavior has been associated with several numerous health conditions, and the review of several studies has confirmed that prolonged total sedentary time. Okay.
Yes,
These things you can ignore, I said, whatever is inside the
Yeah, I
paragraph.
removed this part.
That has a particularly adverse relationship with CVD risk factors. It has relationship with the CVD. CVD risk factors, disease and mortality outcomes means CVD in general. So how do you connect?
Spent amount of time spent inactive, overall amount we can
Prolonged sedentary
life
Time.
time.
Those are the synonymous expressions, right?
Yes.
Yes.
Prolonged time. So that's a particular adverse relationship with CVD. Its level of risk lies mainly on the overall amount of time spent inactive, sedentary life. Even otherwise understood, right? Generally we have understood when there is no activity, you will have more risk of cardiovascular disease. Simple principle. That's what he is trying to say. That's what he is trying to propagate. That's what he said in the introduction. Cool. Its long-term effects are exacerbated by certain medical conditions. It is not mentioned.
They don't mention long-term effects.
Yeah. And technology is not mentioned.
No.
Do they speak anything about technology?
No.
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 And
Father.
do they speak, it differs from person to person? No.
No.
In general, they are saying. So our presumption was right. Is that cool?
Yes, Father.
Yes.
Number
thank you.
9, the writer mentions London bus drivers. As soon as you see London bus drivers or an example, you can go to developing sentence. It's an example. And when there is an example in the question, they are asking in order to means?
Sequential expression.
No, in order to means the purpose. What is the purpose of mentioning London bus drivers here in this paragraph? What is the purpose of the author? In order to prove this, or in order to establish this, or in order to support his argument. Correct. Always writer will bring in examples to support his argument, not the opposite argument, right?
Mm-hmm.
Yeah. Option A, demonstrate the value of a certain piece of medical advice.
Yes. Medical advice. Piece of medical advice.
Okay, piece of medical advice, okay. And B, stress the need for more research into health and safety issues.
More
More
research.
research.
More research into.
Okay. And option C, show how important free time activities may be to particular groups.
Important.
Particular
Particular groups.
And D, emphasize the importance of working environment to long-term health.
Long-term health.
long-term health.
Working environment.
Working environment.
Working environment, long-term health.
Long-term, yes.
Mm-hmm.
Yeah. It's 9, right?
Yes.
Yes.
Yes, 9, Father.
9, yes. Okay. Just read, yeah.
Several occupational studies have shown adequate physical activity in the
Sorry. I lost it. Lost the track. 9, right? 9,
Nine.
yes. Sorry. Yeah. Because I put paragraph number here, I confused. Yes. Yeah. Several
occupational studies have shown adequate physical activity in the workplace also provides benefits. Seatbound bus drivers in London
Now
experienced
this one sec. This is the topic sentence, right?
Quick
Yes.
sentence. Yes.
What does it say?
About the workplace.
Occupational
Several occupational studies have shown adequate physical activity in the workplace.
Adequate
Workplace is
physical.
the
benefit.
Yeah.
workplace. Also provides benefits. Means shown that adequate physical activity. If there is physical activity in your job, in your work, nurses will have less CVD because they run around, but doctors will have more CVD because they sit throughout. If they do, unless they go for rounds every day. Yeah. And continue reading. Seatbound
bus drivers in London experienced more coronary heart disease than mobile conductors working on the same buses, as do office-based postal workers compared to their colleague delivering mail on foot. The APA recommends that all Americans invest in at least 30 minutes a day of physical activity on most days of the week. In the face of such unambiguous evidence, however, most healthy adults, apparently by notice, it must be assumed remain sedentary.
Okay. Any clue?
Father,
Yes.
you
Am I
said
audible?
we have to focus the developing sentence, right? I highlight the developing sentence.
Okay. Now,
The AHA recommend that all Americans invest in at least 30 minutes a day of physical activity and most day of the week. Is that the developing sentence, Father?
yeah.
And
Developing
then-
sentence. Developing sentence here. Soon after the topic sentence, you have the developing sentence. The proof is given.
Example, driver in London.
The proof, bus drivers, no, that is the example. Example means developing sentence.
This is not supporting sentence, Father?
No.
No, right? Okay.
Yeah, no, here there is no supporting sentence because the whole article is speaking about it. So they are saying 7 occupational studies have shown adequate physical activity in the workplace also provides benefits. Now, what is the proof? What is the proof? They are giving the proof. Seat-bound bus drivers in London. They have more coronary heart disease than the mobile conductors who run around. Conductors run around, right?
Yeah.
But drivers sit continuously. So they have more coronary heart disease than the mobile conductors, or as do office-based postal workers compared to their colleagues delivering mail on foot. Those in the post office continuously sit, so they have more of coronary disease, heart disease, whereas those postmen, postwoman or postman who runs around to distribute post, they have less disease. So these are the examples given, proof given. Yes. Which option?
The AHA
What is the purpose of giving these
recommended
London bus drivers?
Emphasize the importance of working environment.
the recommended
To emphasize the importance of physical activity.
But they don't mention long-term health.
Long-term health means
In the workplace.
that is common, general. They are asking about CVD. Keep in your mind the topic, CVD and exercise. The benefits of exercise.
Sorry.
The option is the
Cardiovascular,
same.
Cardiovascular disease.
cardiovascular disease.
Long-term health, they don't mention. I exclude D one, and they don't mention particular group. I exclude C one.
Particular group they are not mentioning. They have mentioned one group bus drivers, one group conductors, one group office-based postal workers, one group those colleagues delivering mail on foot, postman or postwoman. So there are so many groups, right?
And they don't mention more research.
So particular group is opposite of what is given in that paragraph.
Yes.
Do they speak about more research?
No,
they don't mention.
Nowhere they are mentioning about more research. Nothing is spoken about it. When it's a daily physical activity on most days, in the face of such unambiguous evidence, however, most healthy adults, apparently by choice, it must be assumed, remain sedentary. So, demonstrate the value of certain piece of medical advice. What is the medical advice?
Recommended
30 minutes
physical
activity. Invest 30 minutes.
Connect with the previous paragraph. What was the medical advice?
Be active.
Regular active.
No, the more risk remains. Risk depends on prolonged
level of
sedentary life. Prolonged sedentary life, that is the risk. And this paragraph is almost like the whole paragraph is like a proof for that advice.
Continuation of the.
Yeah, you should be connecting the previous paragraph. Previous paragraph said the more you sit sedentary or more you are idle, sitting sedentary, the more risk you have of cardiovascular disease. That's advice. So keep moving. Now they are saying, giving examples of bus drivers in comparison to conductors who move around, and post office men compared to post office, post delivery people, those who run around like Swiggy or Zomato people, door-to-door delivery of the post. Okay. So ultimately, they are proving the medical advice given. Please don't sit continuously. Move around.
Okay.
Activity is required. Clear?
Sorry, Father. Why not D?
Why not? Emphasize the importance of working environment to long-term health.
Though they have not explained about long-term, Father, we think
long-term health is a very general category.
For a long time.
Yeah, it's a big, huge category. Like if it is the universe, CVD is one small aspect of it. Okay. And even in that CVD, there are so many treatments and other things, but this author is just obsessed with exercise, importance of exercise. And working environment is mentioned as an example. That is not the main concept. Working environment is mentioned as an example. For example, you speak about angels or good charactered people. Okay. And you give an example of nurses, health professionals. So what is the concept?
Just the example.
Noble human beings is the concept, not the nurses.
Yes.
Do you understand? Don't make the example the concept. And it is connected to the previous statement, medical advice. More sedentary people will have more risk of CVD. Please move. Did you understand?
Yes.
And they are not speaking anything about long-term health. Do they speak anything about long-term health here?
No.
Nothing.
No,
They're
no,
speaking
Father.
about sedentary. Yeah. So concept must be kept in mind. Okay. Work it out again. If you have doubt again, you can send me a message. Clear? Since I have only 10 more minutes, shall we move on?
Clear, Father.
Yes, the phrase apparently by choice in the third paragraph suggests the writer A believes the health education has failed the public. Health education has failed. Option B remains unsure of the motivations of certain people.
Unsure.
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 Population
Okay.
of unsure of
Okay. Whatever you
motivation
want to
of
highlight.
certain people.
Yeah. Things
Yes,
that
Father.
option C thinks that people resent interference with their lifestyles.
Resent.
They are resent. And recognize that the rights of individuals take priority in health issues.
Priorities. Rights of individual take priorities.
Priority. What is the
Health
priority?
issues.
Yes, priorities
Right,
in
So,
health issues.
please, where you have to go? To the
Last,
highlighted word.
Highlight.
Yeah. Where is the highlighted word?
Just
last
keyboard.
sentence.
Apparently by choice.
Yes.
Okay, it's here. So, in the face of such unambiguous evidence, however, most healthy adults, apparently by choice, it must be assumed remain sedentary. Any clue?
Yeah, unsure. Assumed it's unsure. It must be consumed.
Assumed. Any
Yes.
others?
After ambiguous, the evidence is clear. No.
Feel the public.
However,
Believes.
most healthy
assume.
adults, apparently by choice, it must be assumed
Yes.
remain unsedentary, remains unsure of the.
Remains sedentary.
Does it speak of resentment from the people?
No,
Objection?
no, and I remove
Resentment.
resentment. They are not angry.
Yeah, they are not angry.
And
I recognize that rights of individuals take priority in health issues. Does it speak
No.
anything about right of people?
No.
This sentence, nothing else you need to look. And believe that health education has failed the public?
No.
No. So remains unsure, assumed of the motivations of certain people.
People.
Is that clear?
Yes.
Yeah? B
Yes,
is the
Father.
answer.
Yes, Father.
Yeah. Cool. That's just in the context you have to read and understand. Okay. 11th one. In the fourth paragraph, what does the writer suggest about taking up regular exercise? About taking up, what will he suggest? What will be his suggestion? In favor or against?
Favor. In favor.
In favor. Definitely it must be in favor. Option A, its benefits are most dramatic amongst patients with pre-existing conditions.
Pre-existing conditions.
Okay.
And
And option B, it has more significant effects when combined with other behavioral changes.
other behavioral changes.
Behavioral changes.
Combined with other, it's option C, its value in reducing the risk of CVD is restricted to one particular age group. Again,
One particular age group.
how do you connect with the previous sentence? Does it speak about one particular group?
No.
No, they are speaking in general, not sure, not particular. So you know it is not the answer. It's always possible for a patient to benefit from making such alterations of lifestyle. Always is there.
Possible. Always possible.
Absolutely.
Always possible. Always is.
Absolutely.
Absolutely.
Now, what does the writer suggest? This is his suggestion, his opinion. And I said, usually, in the opinion questions, if there is an absolute, that will be the right answer. I don't know. Don't believe me. Okay? Okay? That's a principle. Let's see. Read fast, please.
Okay.
Please, fast.
The cardiovascular benefit effects of regular exercise for patients with high risk of coronary disease have also been well documented. Leisure time exercise reduced cardiovascular mortality during a 16-year follow-up study of men in the high-risk category. In the Honolulu Heart study, elderly men walking more than 1.5 miles per day similarly reduce their risk of coronary disease. Such people engaging in regular exercise have also demonstrated other CVD benefits, including decreased rate of stroke and improvement in erectile dysfunction. There is also evidence of an up to 3 years increase in lifespan in these groups.
So,
Yeah.
Further, if it's opinion-based question, I have to focus the topic sentence first, right?
no.
No. Okay.
No. Yeah.
Mm,
That is gist-based question.
this is just
Now,
based.
here you see, does it speak anything about pre-existing conditions?
No.
No, usually they will not speak. Now they are he is speaking on concentrating on CVD.
We can eliminate B as well.
It has more significance when combined with other
No, they
behavioral
don't
changes.
mention.
Yeah.
No.
He's not a psychologist to speak
Yes.
about behavioral changes. Okay,
And
entirely
one,
it's out of the stream. Out of the stream. Psychiatry. Third one, its value in reducing the risk of CVD is restricted to one particular group. Already we said
no, they
we are
don't
not
mention.
speaking at all. In the previous sentence, we already established he is not bothered about one particular group, but many groups, all the groups.
Generally.
It's always
So,
possible for
possible for a patient to benefit from making such an alteration to lifestyle means exercise. Such alteration to lifestyle means here exercise.
exercise. Yes.
In short, it means it is always possible for a patient to benefit from regular exercise. This is gist-based inference. Gist-based inference means, see, first topic sentence says beneficial effects of regular exercise. Then leisure time exercise reduce cardiovascular mortality, and then similarly reduce the risk of coronary disease, then decrease the rate of strokes and improvement in erectile dysfunction, increase in lifespan. No, all the studies. It's always possible. Whether you are young, elderly, or you are already having the disease, or you are prone to disease, or you are healthy, always it is possible.
Okay.
Is clear?
Yes, further.
See, men in the high risk category, elderly men, such people, these groups, again says not particular group, right? Behavioral changes is a different concept. Okay, I don't want to run because there is no time. Strategy, evidence, summarization. You have to summarize, gist, multiple examples, one conclusion, exercise benefits everyone. Multiple examples are given. Every example says exercise benefits. And everyone means high risk patients, elderly men, these groups, everyone. And the answer option, stroke reduction, lifespan increase, benefits. Got it? Gist means control from all the evidences. Every evidence says, every study says it is beneficial. For whom? For everyone. For all the groups. Whether it's high risk patients, elderly men, or other groups, it's beneficial. Got it?
Yes.
Yes. Now, 12. The writer says short-term and long-term CVD benefits derive from. Now he's speaking about the benefits of exercise, right?
Yeah.
So from where should it derive from? Where he should say It derives from what? Exercise.
Yes.
No?
Yes.
Writer says short-term and long-term CVD benefits derive from where?
Exercise.
Yeah, from regular exercise. Now, option A, long distance walking. That is
No.
particular.
Mm.
Better cardiac procedures. That is treatment. Right?
Yes.
We are speaking about lifestyle, right? Procedures comes under treatment, right? Am I
Yes.
right?
Yes.
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 Again, fourth one is treatment.
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 It's not an answer. So organized physical activity.
So what is the answer?
Physical
D.
activity.
Organized.
Organized physical activity. It must be, because that is the purpose of the author to establish it. And physical, this is walking is particular. It need not be walking. It can be running. It can be jogging. It can be yoga or any other physical activity, right?
Yes.
That's what he said. Conductors moving around is an activity, physical activity. Postman running around is a physical activity.
Mhm.
So walking is too particular.
In particular.
Okay? It means as if it derives only from walking. No. Procedures, treatment. Concept is different. Treatment of alternate disease. Okay?
Yes.
Yeah. Just read fast because time up.
Among patients,
Okay, you do.
among patients, sorry, read.
Please, one of you.
Who is going to read? Should I read, Father?
Yeah, anyone. Yeah.
Among patients with experience of heart failure, regular physical activity has also been found to help improve angina-free activity, prevent heart attacks, and result in decreased death rates. It also improves physical endurance in patients with peripheral artery disease. Exercise program carried out under supervision, such as cardiac rehabilitation in patients who have undergone percutaneous coronary interventions or heart valve surgery, who are transplantation candidates or recipients, or who have peripheral artery disease, result in significant short and long-term CVD benefits.
Yeah, exercise programs result in significant short-term and long-term CVD benefits. Result in means derive from. Derive from. Clear?
Yes.
We don't require actually from the options. You need not even go to the text.
Result.
Try working out that way just to prove we have gone. The first sentence also says regular physical activity has also been found helpful. Okay? So these skills assess synonyms,
Also been
synonymous language and paraphrasing. Organized physical activity, exercise programs carried out under supervision.
supervision.
Yes. Then 13th one, the writer supports official exercise guidelines for US high school students because US high school guidelines, exercise guidelines for US high school students. This is something like because, the reason, what is the reason? This is something like our name question, no?
Yes.
So option A, it is likely to have more than just health benefits for them.
No, health benefit.
More than health
More
benefits.
than just health benefits.
Will he be speaking about more than health benefits?
No.
He is only bothered about health benefits. Exercise and health. Let's see. B, they are rarely self-motivated in terms of physical activity. Does it speak about self-motivation?
Self-motivated? No.
It is improbable they will take up exercise as they get older.
Improbable.
Improbable.
Older.
Get older.
They will gain the maximum long-term benefits from such exercise.
Maximum long-term
what-
benefits.
They will
Such
get
exercise.
Maximum
Yes.
long-term benefit.
last option.
Any idea?
Last option.
Just read.
Okay.
Since data indicate that cardiovascular disease begins early in life, physical interventions such as regular exercise should be started early for optimum effect. The US Department of Health and Human Services for young people wisely recommends that high school students achieve a minimum target of 60 minutes of daily exercise. They may be best achieved via a mandate curriculum. Subsequent transition from high school to college is associated with the steep decline in physical activity. Provision of convenient and adequate exercise time, as well as free or inexpensive college credits for documented workout periods, could potentially enhance participation. Time spent on leisure time physical activity decreases further with entry into the workforce. Free health club memberships and paid supervised exercise time could help promote a continuing exercise regimen. Government-sponsored subsidies to employer incorporating such exercise program can help decrease the anticipated future cardiovascular disease burden in this population.
Yeah. So whom are we concerned about? High school students, right?
High school students.
Should we bother about college and working men, employees, employers, and all those things?
No.
Not required. Since
Only
data
high
indicates
school
that cardiovascular disease begins early in life, physical interventions such as regular exercise should be started early for optimum effect. Optimum effect, long-term effects.
Long effects.
So start early, have
You will have
long-term
benefits.
effects. So what is the answer?
D.
They will gain.
D. Yes. And rest of these things are not required. College or course employees, because they are speaking about high school students.
Yes.
Did you get it?
Yeah.
Yes, Father.
Yeah. So strategy cause effect chain, logical consequence. Start early, optimum effect, maximum long-term benefit, cause effect chain. Inferential reasoning, cause effect chain. What is the cause? Early, starting early. What is the effect? Optimum effect. That is maximum long-term effect, benefit. Sorry. 14. What does the writer suggest about general physicians promoting exercise? About physicians promoting exercise. What does he say? Is it good? Should they propose? Will he oppose or say, will he say you should not promote?
No.
Will the author say doctors should not promote exercise?
No.
No.
No, he will definitely say, please promote, because he is advocating or promoting exercise. Option A, patients are more likely to adopt effective methods under their guidance.
More likely.
More likely to
adopt
effective methods under their guidance. Whose guidance? Doctor's guidance.
doctors.
Okay. They are generally seen as positive role models.
Positive role models by patients.
Means that he is suggesting doctors, you run every day in front of the patients. You'll be the role model.
They are insufficient.
Okay. Then C, there are insufficient incentives for further development. Further development of what?
Insufficient incentives.
Further development of what? Nothing is given.
No.
It may not be the best use of it may not be the best use of time. Don't exercise. It is not the best use of your time. It's a bad use of your time. Does it go with him?
No.
No, it goes against him, right?
Negative meaning, right?
Negative, right? So it can never go with his opinion. So he cannot be the role model. He cannot suggest doctors, you be a role model, just run every day in front of the patients so that you can be role model. Then there are insufficient incentives for further development of physicians promoting exercise. There is no meaning at all.
Incentives here.
So what is the answer?
A. Patients are more likely to adopt effective methods.
Yeah. See, unless their patients are taking their guidance, he will not request them, right? So general physicians can play an important role in counseling patients and promoting exercise. The topic sentence itself says, counseling means giving, guidelines. Right? Yeah. Although barriers such as lack of time and patient non-compliance, etc., medical reviews support the effectiveness of physician counseling. Please counsel them. Okay? Both in the short term and long term. The good news is that the percentage of adults engaging in exercise regimes in the advice of US physicians, percentage of the adults increased from 22.6 to 32.4. More likely. There's a good increase in the last decade. Okay? Will further increase the percentage and the programs. Given the risk factors of CVD, consistent reducing burden will not improve the quality of, but will increase the lifespan of millions of women, not to mention, will increase the lifespan of millions of humans worldwide. So give advice. So what does it say? Patients are more likely to adopt effective methods under general physician's guidelines. So please guide them. Even otherwise you can understand. First one is what is in support of the author. That's why I said first in the introduction itself, you have to understand what does the author mean, where he stands, what is his position. Okay, God bless you.
Thank you,
Prayer
Father.
time for
Thank
me.
you.
Okay,
Thank you.
God bless you, ma.
Thank you, Father.
Thank you,
If there is some
Father.
doubts, if there is some doubts, you can raise. I will clarify next session. Okay. And about should we go with the A, B, or go with the next mock test? What's your suggestion?
A.
You need explanation
Part
for A and B?
Part A is not good.
You want the explanation of sedation?
Yes.
Tomorrow is mock exam, mock test, right?
No. If you need the explanation, we will postpone the mock test to day after tomorrow.
Okay, Father.
Okay,
What do you
Father.
want?
Father, we want mock test, Father.
I just want
Mock
to
test
Mock
is
test
better.
tomorrow.
Yeah, just post your desires in the main platform. I will collect it and decide, okay? And give a notice. Okay.
please
Thank
do
you.
the part A of this mock test as well.
Yeah,
Father.
just please mention. Yeah, please mention in the
Thank you
platform.
very
I'll
much.
read and decide. Thank you. God bless you. Bye
Thank
bye.
you for your help.
Thank you,
God bless
Father.
you.
Bye.
Bye.
Father. Thank you, Father.
Thank you.
Thank you, Father.
Thank you, Father.
Yeah,